Morning House Calls, sponsored by UK Healthcare.
Welcome back inside Mountain News this morning. Today, Dr. Joe Kingery is with us from UK Healthcare. Thanks for joining us.
Thank you for having me.
Today, we're talking about urinary tract infections in children. So,
Sure.
As a parent, how can you tell if your child does in fact have a UTI?
Great question. So urinary tract infections is something obviously we have to deal with commonly. A lot of people get them. In children, it is harder to tell, so it's a difficult thing to answer sometimes. But some of the symptoms that you see as you get older, you see in children as well. So having to go to the restroom often, urinating more frequently could be a sign that the person has a urinary tract infection. But also if the child is older, they may complain of burning when they go to the bathroom or just some pain when they go to the bathroom. In children that are really small and babies especially, it's really difficult to tell because obviously you may not notice that they're having to go to the bathroom more often. You may see that there's more diapers than usual, or you may not. But the other signs of a urinary tract infection can be that they're complaining of just discomfort, pain, and it can be abdominal pain, it could be in their back, and also a fever that goes along with it. And you don't always have a fever, but you could. So typically, especially in babies, if they're less than 3 months of age, we definitely want to see them in the clinic if they're running a fever because we need to figure out what's causing that. And it could be something really bad. It could be as simple as a urinary tract infection, ear infection, that type of thing. But I would say mostly more urination and any complaints of burning or fever would be the symptoms to look out for.
So when a parent does take their child to the clinic, what are the tests and the treatments that a physician would do?
So typically what we would do first is a urinalysis, basically just get a sample of the urine and test it and see are there signs of infection in it, like bacteria and infection cells that could be there. And if that's the case, then trying to get it treated early on is one of the big keys because obviously if you continue to let it go, then it could get a lot more serious and cause more problems.
Now, is this something that parents may want to try to take care of at home, or is it something that they need to come in and treat at the clinic?
So it's a great question. Obviously, you don't want to get your kids out when you don't have to, especially right now. It's rough weather and stuff. So this is one of those things I would say you need to go ahead and get your child seen if you're really worried that they could have a urinary tract infection. And the reason being because it can progress to more symptoms and people can get really, really sick with a urinary tract infection. As simple as it sounds, it's just a bladder infection, but at the same time it can go on up to the kidneys in effect and even go systematically and cause you to be very, very sick. So it is one of those things I would say, if you want to give some Tylenol or ibuprofen at home to get the fever under control and the pain, that's okay. But you need to go ahead and get the child to the doctor and get it checked out.
Sometimes when we're talking about UTIs, you hear about cranberry juice, fluids. What are some things that you can do to prevent these UTIs from happening?
So it's a great question. So cranberry juice has been proven actually to be able to help prevent urinary tract infections. It probably helps during the infection, mostly more so than anything because there's some fluid going in, helping flush the kidneys and the bladder out. So any fluids will help flush, and that's a good thing. Also, the other problem you worry about is dehydration. So fluids again are a great idea to add, whether it be cranberry juice or other, but it actually causes some increased acid production in the bladder itself when you drink cranberry juice. To prevent it, the bacteria can't grow there typically when that happens. So people have had rebouts, occurrences of urinary tract infections. Cranberry juice is an option to try to help prevent it, and in some cases people have to be on antibiotics long term to try to prevent the urinary tract infections from recurring. But in children especially, and especially if it's a boy, we really worry that there could be something else going on in the urinary system, and that's something we definitely want to see those children for and maybe get additional testing as well.
Thank you, Dr. Kingery.
You're very welcome. Thank you.
We'll have more Mountain News in just a moment.